Are you likely to have kneeling pain in the front of your knee after ACL surgery? I'm Dr. David, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform at your best. Okay, ACL injuries, very common. And for people that play sports that involve landing from jumps or cutting and pivoting to change directions, very, very likely you need to have surgery to stabilize the knee and allow you to do those motions and those activities without your knee giving way. But as I've talked about in a number of videos, there's different options for the graft to make a new ACL. And you can use tissue from your knee, you can use a donor's knee, and I've talked about my preference personally to use your own tissue, what we call an autograft. But is there an autograft, is there a tendon or tissue in your knee that's better than the other depending on your activity level? And in today's Ask Dr. Geier video, I address that question for a baseball catcher about to undergo an ACL reconstruction. Jason asks, Doctor, my 15-year-old daughter tore her ACL playing basketball. The doctor offered either using the hamstring or the patella tendon. He tends to favor the patella, and all I've read seems to point that way. My only concern is the fact that she's a catcher and is in the kneeling position at all times on defense. Softball is her main sport, and she's on track to play in college. The injury was in basketball at a recreational level. Any data on what college and pro catchers do when faced with ACL injuries? I know other competitive athletes tend to lean toward the patella tendon, but the pain from kneeling is our concern. Thanks in advance for your thoughts. Now that's a fascinating question. I got it wrong. She's a softball player, not a baseball player, but catching is very similar in baseball and softball. As for data about baseball catchers, ACL injuries are not a very common baseball injury, so we don't have data generally specifically on baseball catchers. But what Jason's getting at is a very important concept. So when you take the middle part of the patella tendon, yes, the surgeon's gonna close it up and that's gonna go on to heal, but it can cause pain in the front of the knee, especially early on, but even down the road in people that kneel on it a lot. So somebody that's a carpenter or a mechanic where they're kneeling on their knees a lot, maybe we would use the hamstring tendons from that patient's knee and not the patella tendon. We sometimes worry about that in athletes that involve a lot of squatting or jumping. So volleyball players, maybe baseball catchers, you might consider using the hamstring tendons as well because of aggravation at the patella tendon harvest site. Now, very often you can work through that with quad strengthening and things like that. But that does make sense, and it might lead me to think about using the hamstring tendon in a baseball or softball catcher, just like in a mechanic or carpenter and things like that. I still think either of those options is better than using an allograft in a high school or college athlete. But that is an important thought. So if you're dealing with an ACL injury and you're talking to your surgeon about what graft you use, talk about the activities that you do, what sport you play, or what you do at work, because it might have a role in the graft that you choose. Now, have you suffered an ACL injury, and what graft did you choose? Or if you're dealing with an injury and trying to decide, what are the thoughts about the factors that are helping you to decide what graft to use? I'd love to hear your experience, so below this video, talk about your injury and what graft you're choosing or leaning towards choosing. It's not just that I'd like to read it, but I know people watching this video all over the world that are dealing with an ACL injury would really love to hear your experience as well. If you know somebody who has an ACL injury, or maybe one of their kids does and they're trying to plan for surgery, please share this video with them, and hopefully it can help them have a better idea of what to do. If you like videos like this and you want more information on sports and exercise, injuries and injury treatments and injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of the page. It says subscribe. I record a couple of these videos every single week and they'll get delivered directly to you. Thank you so much for watching. Again, please share this video if you know somebody dealing with an ACL injury, and I look forward to seeing you right here next time.